Hi, and welcome to Wow Talk. I'm Donna Cappuccitti, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness.
Welcome.
Hi.
Hi, it's been quite a while. It's good to see you again.
You too.
Anyway, today we're going to talk about bladder health.
In women.
Women. Yes.
Yeah. So it's a very common problem for women, especially after menopause, but even well before that. Women, especially who've had children, things change down there. The pelvic floor, sometimes there's trauma with giving birth. And generally with age and gravity, just like our breasts can drop, so can our organs.
Exactly. I've heard about people whose bladders have dropped. And is that exactly what that means? Because of gravity, it's lower? I don't quite understand what that means, really.
It can get pretty bad to the point of what we call a prolapse, where the organs drop into the vaginal canal, and even sometimes to the point that you feel the pressure or see the tissues very swollen because it's dropped, inches away from where it should be. And thankfully, I don't see a lot of women who are in that position. A lot of times, when it's gone that far, it's really realistically something that's more of a surgical solution. But in many women, as we age with declining hormone levels, another factor is that the linings become very thin and the tissues are more easily infected because the moisture level is not there and the bacteria are not as easily flushed out of the system.
Okay, that's so interesting. Mm-hmm. So let's talk about urinary tract infections and and how that affects the bladder, why we get them, different things that cause them. Mm-hmm. And I do want to ask this one question. Mm-hmm. It just came up recently. In fact, my daughter brought it up. After sex, I've always heard that it's very important to urinate to prevent a UTI. Is that just a wives' tale or is that real?
No, it's anatomy.
Okay, explain.
So the female urinary tract is a shorter channel. And during intimacy, the local external bacteria can make their way into our body. And so if you pass urine after being intimate, it just kind of flushes fluids in the direction of leaving the body rather than entering the body. So it's a good practice. And even in female children, because our urinary tract has a shorter passage, it's very important that little girls not stay in wet bathing suits and practice good hygiene, wiping from front to back. And some women and children and girls are affected more than others because we're all shaped a little different. But with aging, things just get worse. So first there's gravity, then there's women who've had children. And this is the way I'd explain it. When you are pregnant, you have this growing baby in your uterus, and it's basically pushing your other organs out of the way. Mm-hmm. And then when the baby comes out and the uterus kind of goes back to its non-pregnant size, like think of having a balloon. And if you blow up that balloon and then you let the air out, the balloon's not the same anymore.
No.
And in our body, the organs sort of kind of go back to where they were supposed to be, but not always in the most perfect way. And osteopaths are really good at assessing the organs and doing some hands-on physical therapies on the abdomen. And sometimes I refer patients out for pelvic floor physiotherapy that can help women with hands-on techniques or different recommendations about how to control bladder function, improve the communication of the brain to the bladder. And also sometimes women are responding very well to topical vaginal estrogen creams just to help with the texture of the linings to go back to a younger state.
Okay, so what would pelvic floor therapy be? What is that?
Well, it's a certain area of physiotherapy that works on men and women with different dysfunctions of their pelvic organs, very often urine symptoms, and sometimes they can make a difference. And working with scar tissue or muscle tension, and like I said, helping people improve the communication of their brain to their urine habits. And the other thing that really surprises me is that I always ask patients, how often have you had bladder infections? And when you have a UTI, people know they have burning and frequency on urination. But I'm surprised how many women have trace amounts of infection in their urine that are not treated. And you don't have the symptoms. And even often when my patients are on an antibiotic and their big obvious symptoms have cleared up, and I'll ask, did your medical doctor check the urine after the antibiotic to make sure that the infection is clear? And that step doesn't always happen.
No, I don't think that's ever happened in my life.
Yeah. So I've learned to look for that. And then if the medical doctor didn't do that test, then I'll do that test in my office. And I'll often find that the infection is less enough that you don't feel the symptoms, but I still see it there on the lab test.
Oh my. Then what would you recommend for that?
Well, in the naturopathic field, there's a variety of recommendations. So many people already know about cranberry juice, cranberry pills, cranberry extract.
Yes.
Cranberry and D-mannose, a special kind of sugar, those two are sold individually or together in a supplement, and those are what are called anti-adherents. So they affect the inside lining of the bladder to make it more moist so that the bacteria detach easier. So a dry, pasty lining, things get stuck to that easier and have enough time to breed the bacteria to a larger amount.
Oh, yeah, that makes total sense. Okay, here's another question that I wonder is a wives' tale or not. What about drinking apple cider vinegar? I've heard that that's really good to prevent UTIs.
I haven't really been recommending that one. Sometimes I will recommend baking soda, and that works like a charm, but it is not something that you can do long term. It's just a first aid here and there to alkaline shock the pH of the urine, and the bacteria that like to live in the bladder, they are more readily destroyed by a more alkaline environment.
Okay, that makes total sense. Now, what about women who have had hysterectomies?
Yeah, that's a really big influence on bladder health because there can be scar tissue and the organs used to be neighboring, and now one of the organs is gone. So it's very common for the absence of the uterus to have negative consequences on the positioning and or the function of the bladder. So depending on why you need a hysterectomy, very often it's, in my experience, very often it's a woman from 45 to 50 years old and she has fibroids and her periods are too heavy and she's losing all her iron and she's exhausted and she's bleeding too often, too heavy. And the solution is, with medical doctors to remove the uterus, which is fine because you're getting close to menopause. You're probably not thinking of having any more babies. But I usually find that you can smooth out the hormones, wait it out, and after menopause, the fibroids will shrink, and you have a better chance at having better bladder function after menopause if you can keep the uterus.
Okay. That's really good advice and something for us to think about that we're not often advised about or on. And okay, so here's another question, and I don't know if this is mostly with younger women or children. What about something like a dilated ureter? Now, to be honest, my oldest daughter had that when she was very little, and but then she grew into it. So we didn't have to do anything surgically, but that did cause a number of UTIs. And of course, we didn't know what it was. Like, we didn't realize that's what she had. It took a few years to figure out what was going on and why she was getting these horrible fevers and screaming in pain. We didn't know what was wrong. And it finally was discovered when she was only about 3 years old. It was, poor thing, it was awful. But then she did. She was on, oh my gosh, the antibiotics, but prophylactic ones, which worried me. And at the time, you helped us with all of that to try to counteract it with the probiotics and somehow we weathered the storm and we did get through it. But I don't know if you have any advice on that.
Well, situations like that, it's a structural problem that interrupts the function and the position of the organs. And thankfully, when it's something happening with children, a lot of the times the child outgrows it and their body parts become more proportionate to each other and more coordinated with how the whole body functions. And if it was a bigger problem, sometimes it's a more surgical thing. But it's always worth exhausting natural options of trying to give it more time to see if you can outgrow a situation like that. And even if someone did need surgery, to do the natural approaches first would be reducing the chance of how much surgery you need. So if you did have surgery, it might be less surgical intervention would be needed because you maxed out fixing your chemistry and inflammation, etc. And also you would be improving the quality of wound healing.
Oh, yes.
Yeah.
Yeah.
Yeah. If you know about things like zinc and protein intake and how much they can help with recovery from a surgery.
Okay. That's great advice on that. So back to the whole menopause thing and our bladders dropping. And and the other thing, too, I have to say, let's think about seniors, because another thing, it's all about my family now. My mother, who had had a stroke, that became an issue, too, because she was paralyzed. She was sitting a lot. And so we had to be so mindful of trying to prevent UTIs. And that can also be a horrible thing for older women, of course. Like I remember, too, it would make her confused. There were these symptoms that we would see right away, like the confusion, the fever, she'd be uncomfortable. And we did do what you were suggesting with the cranberry pills. She took those all the time, for her bladder health. But, anything we could think of there to help prevention in older women?
Well, it's more of a practical situation in that particular case where usually someone who's had a stroke has to wear diapers.
Yes.
And so you're constantly trapped in this warm, moist environment and not just bladder infection, but that could also create the environment that's very welcoming to yeast infections as well. So just really meticulous hygiene and it's not easy to stay clean and dry when you're stuck in a wheelchair and you can't move around and you might not even feel what's happening down there. And the other thing too that I've learned with experience is sometimes when you've done all the obvious things that work on everybody else, I have had some patients where their bladder dysfunctions and predisposition to infections was actually food sensitivities.
Yes.
Affecting the lining of the bladder. So sometimes I've even done food sensitivity testing and it's worked like a charm.
That's really fascinating, but makes sense. Totally. Is there anything else we haven't covered here that we should?
Yeah, one big one.
Oh, gee. Okay.
Yeah. So I went to this huge, amazing conference just before COVID, and it was about autoimmune diseases.
Okay.
And 80% of the people who have autoimmune diseases are women. But they did not find that there was a genetic link. So it's not because you're a woman that you're predisposed to autoimmune diseases. They actually connected to silent bladder infections as a big trigger to starting autoimmune diseases.
That's huge.
So after learning that, I really stepped it up, checked more people just because I had no reason to check, but I knew that it was worth checking, and I'm finding these silent UTIs in about 1/3 of my practice. And even sometimes the patients sharing the medical report from the medical doctor, and they did the same urine test that I would have done, and it's right there, and the medical doctor just lets it go because they think it's good enough. But the conferences that I've been going to, they're making a bigger deal out of not accepting even the trace amounts of silent infections, that they're worth staying on top of and keeping them out of your body.
Wow. That is really interesting. Well, I think we've covered quite a lot here.
Yeah.
But maybe if there's anything else, if you have any questions or comments, please send them to us. Please follow us on social media.
Thank you for listening.
Thank you.
Bye.
Bye.